Ladies and gentlemen, please be seated as we'd like to start the program. Welcome. Good evening again, ladies and gentlemen. Thank you for your patience. We are ready to start with the proceedings of the evening. A few of our guests are still expected, but they have informed us to start the function. So with everyone's permission, we request to proceed. Like I said, kindly put your mobile phones on silent mode or switch them off. We have all gathered here to witness a momentous occasion, a special collaboration between two very well-known names in the field of ophthalmology in North Karnataka. These two institutions and names have a very long legacy in the field of medicine, and they have come together with the motto, United for Vision, with a united vision. These are both very, very well-known families in the field of medicine, and therefore the importance of this occasion needs to be underlined. In the words of Henry Ford, if everyone moves forward together, then success takes care of itself. This coming together of Joshi Eye Institute and Kodkany Eye Centre will surely pave the way to many, many grand things ahead. We have all gathered here to wish them well and witness this joint venture, a merger for greater good in the field of ophthalmology. On this full moon night of Kojagiri or Sharad Purnima, I think the two parties couldn't have chosen a more auspicious day, because where the radiance of the moon will grant all that is wished for. I welcome you all for this occasion on behalf of Kodkany Eye Centre and Joshi Eye Institute. नमस्कार, सुस्वागतम. आप सभी को अभिवादन करके हम अब कार्यक्रम की शुरुआत करेंगे.
I call upon Dr. Kodkany, Chief Consultant and Medical Director of Kodkany Eye Centre, to welcome the August gathering. A very good evening to you all. It is indeed an honor and my personal privilege to be welcoming you all on this momentous day in the life of our two stalwart organizations, Dr. Joshi Eye Institute, Hubli, and Dr. Kodkany's Superspeciality Eye Centre, Belagavi. The two organizations are coming together to deliver quality eye care for all. We are united for vision. We are blessed to have Padma Shri, Dr. Joshi sir, with us here this evening, who has always inspired us to become better clinicians, surgeons, and great human beings. I humbly welcome you, sir. On behalf of Dr. Kodkany's Eye Centre and the directors of Joshi Eye Institute, that is Dr. A.S. Guru Prasad, Dr. K.V. Satyamurthy, Dr. Krishna Prasad, and Dr. Srinivas Joshi, I welcome a mentor, a dear friend of the Kodkany and Joshi families, a guiding force to many of us doctors, Dr. Prabhakar Koreji, Chairman KAHER Society and Chancellor KAHER. We welcome our honorable and esteemed guest, a friend, philosopher and guide, Shri Raju Sait ji, MLA Belgaum North. We welcome a dear friend, I can say more so family, Shri Madhav Gogte, MD Gogte Group of Companies. It is also a privilege to welcome dear friend, a fellow Rotarian and a philanthropist, Shri Anish Metrani, MD Sneham Taping Solutions Private Limited. We also welcome the doctors from IMA, ophthalmologists of Belgaum Ophthalmic Association, my fellow Rotarians and aunts, family, friends, members of Joshi family, our staff, and thank them all for their consistent guidance, support, and friendship. I would also like to acknowledge the presence of Shri Narendra Murkumbi, Shri Nandan Yargi, who are dear friends of our family, who have traveled to be here with us today. I welcome the members of press, the media, and appreciate their constant support for our efforts. I wish to take this opportunity to introduce you all to the pillars of Dr. M.M. Joshi Eye Institute. First of all, Dr. A.S. Guru Prasad, a senior vitreoretinal surgeon of national and international repute who brought cutting-edge technology of retinal treatments and surgeries to the North Karnataka region more than 40 years ago. Dr. K.V. Satyamurthy, an eminent cornea and refractive surgeon who introduced corneal transplants for treatment of blindness to the people of North Karnataka. I remember a couple of years back, he was doing live surgery in a conference. It was an extremely hard cataract. We all surgeons had our hearts in our mouth watching him, knowing how difficult it was. After that, we now call him the Iron Man. Hands of steel which cut hard cataracts like slicing through butter. Dr. Krishna Prasad, a teacher par excellence with innovative teaching methodologies, a stalwart in cataract, glaucoma, pediatric ophthalmology, and oculoplasty. His students very fondly call him a walking, talking encyclopedia of ophthalmology. Dr. Srinivas Joshi, a vitreoretinal surgeon of national and international repute who has won many awards for his videos on extremely challenging retinal surgeries. We have seen him perform those acrobatics with effortless ease. And finally, though I have already spoken to you about the inspirational force behind all that is Dr. M.M. Joshi Eye Institute, I must say that Padma Shri Dr. M.M. Joshi Sir's leadership in the field and more importantly in society has created a lasting impression on all of us. May I respectfully invite you to the stage, sir. I also invite Madam Joshi Madam to please also accompany sir.
We have amongst us an accomplished and an eminent personality who is an inspiration to many. I request Dr. Shilpa Kodkany to escort His Honorable Dignitary Padma Shri Dr. M.M. Joshi and Mrs. Pramila Joshi to the dais. I kindly request Dr. Srinivas Joshi to escort the chief guest, Honorable Dr. Prabhakar Chairman KAHER Society, Chancellor KAHER Academy of Higher Education and Research, Belagavi, and KAHER Technological University, Uttar, to the dais.
Welcome, sirs. Thank you, Dr. Joshi and Dr. Shilpa. May I now call Mr. Kirti Nerlikar, Director, Kodkany Eye Centre, to please escort MLA of Belagavi North, Mr. Asif Sait Ji, who is very fondly called as Shri Raju Sait, to the stage. He is an inspiration behind many of the philanthropic projects in Belagavi North constituency. Thank you, Mr. Nerlikar. May I now request Dr. Apurva Aichit, who is the Director of M.M. Joshi Eye Institute, to escort Managing Director of Gogte Group, Shri Madhav Gogte, to the dais. Madhav is present here not only as an industry leader, but also in a dual capacity as a close friend. Thank you, Dr. Apurva. Last but not the least, I request Dr. Dipti Joshi, Director, MM Joshi Eye Institute to kindly escort another industry leader and committed Rotarian, Shri Anish Metrani, to the stage. Thank you, Dr. Deepthi. With this constellation of guest stars present here today, I'm sure you all agree that this stage is glowing with a warm light of good wishes and blessings. Thank you all for gracing the occasion and making time from your busy schedules. I request the directors of MM Joshi Eye Institute to please take their seats on the dais.
Let us make an auspicious beginning by invoking blessings from Goddess Saraswati with a melodious song by Mr. Yogesh Ramdas.
Hello. Hari Om. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwaraha, Gurur Sakshat Parabrahma, Tasmai Shri Gurave Namaha. Shuklam Brahma Vichar Parama Adyam Jagadvyapinim Veena Pustakadharinim Abhayada Jadandhakarapaha Haste Spatikamalika Chadadati Padmasane Sanstita Valdeta Parameshwarim Bhagavati Buddhi Prada Sharada Buddhi Prada Sharada Buddhi Prada Sharada. धन्यवाद.
Thank you, Shri Yogesh Ramdas ji. I'm sure this invocation rendered in such a melodious voice has surely reached the divine. Before we officially commence the event, we would like to recognize the presence of some dignitaries in the audience. First and foremost, Dr. H.B. Rajshekhar sir, Dr. V.D. Patil sir, both ex-principals of JNMC and noted personalities in the field of medicine in Belgaum. Shri Gopal Jingauda ji, who is a noted industrialist and philanthropist from Jinnabakul Forge. Dr. M.V. Jali, who has held the reins of KLE for a very long time and now serves as Chief Medical Advisor to KAHER. Thank you all for your presence. It's now time to commence the event officially. To set the proceedings in motion, we will be lighting the ceremonial lamp. I request all the dignitaries to join our chief guests, Honorable Shri Prabhakar Koreji and Dr. M.M. Joshi sir, in lighting the lamp. Tamasoma Jyotirgamaya. From darkness, lead us onto light. I'm sure you all agree that this has a very special connotation today as we are talking about two ophthalmic hospitals. May I request all the dignitaries to please help our photographers to capture this moment in a beautiful frame. We also recognize the presence of Dr. Shivram, who has traveled all the way from Shri. He's an eminent ophthalmologist and past president of the Rotary Club of Shri. Welcome, sir.
Flowers are an expression of love, gratitude, and friendship. I call upon the directors, Dr. Shilpa, Dr. Srinivas, and Dr. Guru Prasad, to honor the dignitaries with a floral bouquet and memento.
At the outset, I request the directors to welcome our honorable chief guest, Dr. Prabhakar Kore, with a floral bouquet and also offer a memento and a token of love and respect. Sir, we are truly honored by your presence here today. Now I request Dr. Shilpa, would you please offer a bouquet to the doyen of ophthalmology, respected Padma Shri Dr. M.M. Joshi and Mrs. Pramila Joshi. So your presence and your persona are truly inspiring to us all. Thank you very much for gracing the occasion. Please give them a big round of applause.
I call upon the directors to honor Shri Raju Sait, MLA Belagavi North, with a floral bouquet and memento. Thank you for your gracious presence. I now request to offer bouquet and memento to our special guest, Shri Madhav Gogte, Managing Director, Gogte Group. I request to present bouquet and memento to Shri Anish Metrani, Managing Director Sneham Tapping Solutions Private Limited.
Thank you, everyone. Helen Keller said, and I quote, "Alone we can do so little, together we can do so much." I'm sure this was the thought in Dr. Shilpa's mind when she decided on this collaboration. Or maybe it was the famous African proverb which goes, "If you want to go fast, go alone. But if you want to go far, go together." I request the IT team to now play a video which has been made specially for this occasion so that the audience gets an understanding and an insight into what this collaboration stands for. What exactly does it mean when we say united for vision?
From the depths of darkness, sight restores a universe of color, light, and wonder. Vision is not a luxury, it's a miracle we must protect, restore, and cherish. Each pair of eyes holds a universe waiting to be discovered. Together, we can bring light to those still in darkness.
I am Dr. Shilpa Kodkany, Chief Consultant and Medical Director, Dr. Kodkany Superspeciality Eye Centre. Way back when I was in my 12th standard and I had to decide what I wanted to do in life, I very honestly didn't want to be a doctor because my parents, being gynecologists, I had seen their life, which was so very busy. We had to go for dinner to Dr. Prabhakar Kore's house. That time, Kore sir told me, "Shilpa, you have to be a doctor." And that is how my journey as a doctor started. I finished my MBBS. I decided on ophthalmology and then went to Bombay to hone my surgical skills. Then, in the year 2000, after the untimely death of my mother, I came back to Belgaum. I joined JN Medical College as a teacher, and I also started a small clinic in the same premises where my parents' hospital was, and that's how I started practice in Maruti Galli. In the year 2000, this particular surgery for cataracts, which is called phacoemulsification, was very new. It was a very small incision, no stitch, no injection, no pain, and a very fast surgery. And my patients were very, very happy with this kind of a procedure where we would not even patch the eyes. I also introduced the glaucoma services in our center in Maruti Galli. In the year 2008, we started off with refractive surgeries, being able to give spectacle-free vision to the young people. In the year 2016, our hospital was one of the first hospitals in the private sector to get the permission to do corneal transplants. We got the NABH accreditation, that is National Accreditation for the Board of Hospitals. This helps not only for safety of patients, but for the safety of our staff, of our consultants, and every person who is in the organization. It's not only work all the time. We have some motivational activities like employee of the month, employee of the year, depending upon certain criteria that we follow, so that it's not like all work and no play makes John a dull boy. Being in Maruti Gully, our patients started complaining about parking spaces, not being able to come in those crowded hours. In the year 2016, we started construction of our new hospital, and we started that hospital in the year 2019. Chief guests for the inauguration of that hospital were again Dr. Prabhakar Koreji and Dr. M.M. Joshi.
Shastra says that you have to respect Matrudevo Bhava, Pitrudevo Bhava, Acharya Devo Bhava, Atithi Devo Bhava, and in fact, I would like to add one more thing, that it should be Samaja Devo Bhava, because we are supported by the Samaja and we serve the Samaja.
My name is Dr. Srinivas Joshi. I'm basically a vitreoretinal consultant, and I'm also one of the directors of MM Joshi Eye Institute.
समीर, अच्छा दिख रहा है कि नहीं दिख रहा है?
पहले से भी बेटर है,
बहुत बेटर।
तुम्हारे सब लोगों की कृपा से।
हमारे ऊपर वाले।
MM Joshi Eye Institute journey started way back in 1967 with Padma Shri Dr. MM Joshi, the founder chairman. Dr. Joshi sir always had it in mind that we need to make this North Karnataka an avoidable blind-free state. We're starting with 13 tertiary care branches with more than 22 vision centers and serving more than 3.5 crore population. Why we built this ICD is we always had it in mind that we have to cater to all economic sections of the society. Apart from patients coming to our OPD, we approach door to door in these vision centers. We have a trust hospital where we are doing around 1,000 surgeries free of cost every month. If you see our slogan, nobody shall be denied the right to good vision, is what was said by our chairman, Dr. Guru Prasad. He joined in 1983, and in fact, he is the first person to develop vitreoretina department in the entire part of North Karnataka and Goa.
Dr. M.M. Joshi was my uncle, and he persuaded me to join ophthalmology. I migrated from Bangalore to Hubli in 1982, and since then I've been here since 43 years now. After coming back from the fellowship in Chennai, I started the vitreoretina department in Hubli in M.M. Joshi Eye Institute. The main strength of our hospital is ethics.
Dr. Satyamurthy, who is a cornea and refractive surgeon. So he got trained in Arvind, and he brought in a lot of cornea practices and refractive surgical procedures to our institute.
For the last 3 decades, I am associated with this hospital. I am a part of the DNB program here and all the modern activities that took place here.
And in 95, Dr. Krishna Prasad, after completing his post-graduation from AIMS, New Delhi.
So I normally work in the anterior segment, that is the cataract surgery part. I'm also into glaucoma and a bit of pediatric ophthalmology, orbit and oculoplasty. And this last 30 years, we have seen an incremental growth in the kind of public trust that has been reposed on us. At the same time, the kind of advanced technology that we have acquired.
Over a period of time, I realized that our patients were increasing, and I realized that I couldn't handle everything alone. So we had Dr. Anand Puranikmat.
I'm working with Dr. Shilpa Kodkany ma'am since past 10 years. I've grown even surgically as well as personally also. It has helped me a lot. Her expertise and her skills, they have made a very lasting impact on my life.
He is a great surgeon. He has kept abreast with technology and keeps himself updated, and he is a great asset to our organization. And Dr. Raghavendra, who is a retina surgeon, we are able to do all kinds of retinal surgeries, retinal injections, lasers, everything because of him.
Previously, I got trained in Arvind Eye Hospital, Madurai. After that, I worked in Andhra Pradesh.
He is somebody who talks very nicely to patients, and he is able to gain their confidence, and he does a great job.
Hello, Dr. Kodkany Eye Centre. आज आहे की सर सॅटर्डे वाजता इथे मातीकणीमध्ये.
Maruti Gully today is mainly a charitable wing, so we had to, of course, take in more consultants. So that's when Dr. Sanjay Pachapure joined us in the year 2022. We do free OPDs every Saturday. We have also started Dr. Kodkany Foundation in memory of my parents. After my mother's demise, every year on 18th of December, which happens to be her birthday, I have been doing free surgeries.
माझ्या आता त्या फ्रीमध्ये मी डिसेंबरला करत होते का नाही तेव्हा करायला लागलं. डोळ्यांना अजिबात दिसत नव्हतं, लांबचं जवळचं जरा दिसत होतं. त्याच्यामुळे आम्ही इथे 2दा दाखवले आणि त्यांनी आमचं फ्रीमध्ये गेल्या वर्षी. मला पहिला जमन दिसायचं म्हणून मी इथं दाखवायला आलो. मला दाखवायला म्हटले त्यांनी तुम्हाला मोतीबिंदू झाले.
2.5 वर्ष झाली जवळजवळ आणि हा मोतीबिंदू होता.
ನನ್ನ ಕಣ್ಣು ಒಂದಲ್ಲಿ ಎರಡು ಆಪರೇಷನ್ ಆತ್ರಿ ಸರ್. ಈಗೆಲ್ಲ ಅದು ಚೆನ್ನಾಗಿ ಕಾಣ್ತತ್ರಿ.
ऑपरेशन थिएटरमध्ये तर फार काळजी घेतली. हो काय
नाही सगळे चांगले मला हे केले, सांभाळून घेतले आणि माझे डोळे बरे येत आता.
एक नंबर नाव करतो आणि आणि कोणी विचारले ते नाही डॉक्टरचं नाव करतो.
ಮೇಡಮ್ ಅವರು ಡಾಕ್ಟ್ರು ಎಲ್ಲ ಬೆಸ್ಟ್ ಅದ ಸರ್ ನನಗೆ.
एवढं धन्यवाद मॅडमच्या कृपेला आमचं चांगलं झालं ऑपरेशन.
The joy on their faces, this is something that is priceless.
Dr. Shilpa Kodkany, madam, in fact, she was my teacher. When I was studying, when I was doing my post-graduation, I used to hear, Shilpa madam means once she goes to Goa, she does around 70-80 cases and then comes back.
Retinal services was becoming a challenge for us. So I approached Dr. Srinivas Joshi and Dr. Guru Prasad.
A journey with Kodkany Eye Care Centre started with a retina practice, and one of our consultants used to go there, operate every week.
And also some of the refractive surgeries, like I said, the laser procedures, I have been taking those patients from Belgaum to Hubli.
In Belgaum, we have a lot of competent team with Dr. Kodkany. The competent team is there with Dr. Joshi's Eye Institute. So if we club together, I think it's only adding on. Like try to add in more refractive machines, including we have now have the Z8, which is one of the newest kid in the block, but extremely super machine for removing your glasses. And in other words, I would like to say a robotic surgery, a robotic cataract surgery, or a robotic LASIK surgery. Corneal lenticular procedures are being done with that machine, and fortunately it's a mobile machine.
Over a period of time, we both thought that it is time we did this kind of a merger. A very good morning to all of you present here. We have all gathered here today because our hospital, Dr. Kodkany Eye Centre, is merging with Dr. M.M. Joshi Eye Institute from Hubli.
So this merger, it marks a new chapter in our eye care, and it will be very helpful for this part of Karnataka, and especially for the people of Belgaum.
The Kodkany Eye Hospital has been working in the Belgaum area, so they have their strengths. They have already have the public trust. She almost shares the same ethics, the same work culture, and the same kind of public trust that our M.M. Joshi Eye Institute also is enjoying. So with M.M. Joshi coming in, we can also fill some of the gaps, especially some of the super speciality areas.
Merger is going to be definitely beneficial. So whatever has been happening in Kodkany Eye Centre will continue in Kodkany Eye Centre even after the merger.
For us, it will be like a broader way of treatment. I am very fortunate to have the guidance and expertise of the two best vitreoretinal surgeons in the country. That is Dr. Guru Prasad sir and Dr. Srinivas Joshi sir.
The way she has developed over a period of years, and the way she has developed her own institute, and she has created her own benchmark of the quality. So it's a very good thing for us, so that we can get associated with this particular thing.
And I'm very, very excited and I'm very thankful to the M.M. Joshi Eye Institute that we can come together for this great purpose.
In one sentence, if I would like to say why this merger has happened, why this association has happened, is to make Belgaum people get an affordable pricing for the best of the technological advances.
The last 25 years have been very, very enjoyable, very gratifying, very humbling also. And the people that come to my mind, firstly, both my parents. The other person, Dr. Prabhakar Koreji, without whom I would never have become a doctor probably. My husband, who has been a constant support. My mother-in-law, she has stood by me rock solid, and I have my 5 Pandavas. One of the oldest ones being Lakshmi. She started off as a reception staff and today she is an optometrist. Sangeeta, who joined as a receptionist. Shruti, she came in as a receptionist. She is today one of my chief admins. Sameer, who is my operation theatre in charge. Rekha, an optometrist who joined us many years back. Today she is head of optometry. These 5 Pandavas, I can never forget what they have done for me. They are family to me today. For a successful story as a doctor, it is our patients. Without our patients, we would be nothing. I am very, very thankful to all my patients. They are, in fact, I would say, our inspiration to do more and more. Last but not the least, Dr. Joshi Eye Institute and all the consultants, Dr. Srinivas, Dr. Guru Prasad, Dr. Krishna Prasad, Dr. Satyamurthy, they have been a really guiding force, I can say, and I'm very happy and excited for the journey forward with them.
Thank you for the wonderful and informative video. It was really heartening to see the gratitude shown by the patients. And here I would like to emphasize that I also got operated for my cataract in Dr. Shilpa's hospital, and I have experienced the same compassion and same affection by Dr. Shilpa and her entire team. I'm really thankful to all of them. And my vision has definitely improved with that. I don't need to wear my glasses now, for which I am thankful to her. Here I would also like to make a special mention and thank Sanket Kulkarni, who has directed and captured this beautiful video. Sanket is our very own talented cinematographer from Belagavi. Technological advancements have revolutionized medical science. The application of cutting-edge technology is very precise and thus is very effective. This also improves the treatment outcome. I now call upon Dr. K.V. Satyamurthy, Dr. Krishna Prasad and Dr. Srinivas Joshi to shed light on benefits of these cutting-edge technology.
Good evening, ladies and gentlemen. It's a great day today where the 2 eye care centers are coming together for a better vision and better services. Dr. Shilpa Kodkany has already been delivering advanced eye care in this part of the country. So now that Joshi Eye Institute has also joined, it has already been mentioned that all those facilities which are available with us are definitely will be extended to people of Belgaum and this part of the country. This includes the world's latest technology, that is Zeddite. The machine which was shown earlier in the video, the machine can do a lot of things. There's robotic cataract surgery, which is stitchless. It can remove glasses with the world's latest technology called Clear, and then it can also help us to perform the corneal surgeries. This black portion of the eye, what we call as cornea, so such as corneal grafting, intacts, and management of keratoconus. So as such. And moreover, this is the most important thing of this particular thing is, it is portable. It can be taken from one place to the another. So from Hubli, it can be brought to Belgaum. In a nutshell, what I can say is this machine helps us to remove glasses for all age groups above 18 years of age. Okay, so that is the machine which is being brought, and this is the machine which is definitely help us to perform all these activities. And there's a special vehicle which has been modified and designed particularly for this, so that it can be moved from one place to the other. I'll briefly tell you about the robotic surgery, because just mentioning about robotic surgery may not convey a lot of things. The cataract, as you know, that will be in a bag, and then that with the because of the cataract the vision is decreased. So what we do is we just cut the front portion of the bag, remove all the cataractous material, and then put a clear foldable intraocular lens inside the bag. So this is exactly what is done for the cataract surgery. Now, when we remove the front portion of the bag, that is the capsulotomy, it has to be 5.2 millimeters. It should be round, circular, and it should be central. So these are the requirements which is not possible every time to get manually. Whereas a robotic machine like this definitely helps us to achieve this particular thing. So that is one advantage. Second thing is, this particular laser, that is a robotic machine, it helps us by easily removing the cataract. It makes small pieces of the cataract inside that can be aspirated with the help of a machine called phacoemulsifier, and then we can implant the lens inside the bag through a incision, through a wound, entry wound as small as 2.2 millimeters. And then it also helps us to make the entries very precisely. And then the corneal grafting, which we used to, especially this corneal people suffering from corneal blindness, instead of doing earlier we used to do manually. Now the precision has been added to this. With the help of this particular machine, we can remove the cornea very easily and then do it. So with this, the other facilities like low vision aids for people suffering from low vision because of so many other conditions like age-related macular degeneration or whatever, or glaucoma, and then the ocular aesthetics, and then there's so many facilities which are available with us will also be extended to this particular area of people through Kodkany Eye Centre. So thank you very much.
All eyes are on Belgaum today, and for a good reason. So I'll be specifically talking about two specific value additions that this merger can bring in. One is all about the childhood blindness and the eye problems in children. So I'm a pediatric ophthalmologist. So we have a team which has been working in the treatment of eye problems specific to children. We are now staring at a pandemic of myopia. See, the children who wear glasses, the myopic glasses, it is estimated presently around 20% of children need glasses. In another next 10 years, we will be having around 35% of our kids, our children and grandchildren, have to wear glasses with all its problems for the future. So we are very seriously trying to tackle this problem, and it has been a global problem, and we have what's called a myopia clinic, which is going to work on this. We also have a very specific team for squint and pediatric cataract correction, and all those services will be available in Kodkany Eye Centre here afterwards. And the second problem in which I specifically work is what is called glaucoma. Glaucoma is a blinding disease which comes without any warning, and it usually causes an incurable blindness. And the treatment of glaucoma involves routine surgeries and some specialized techniques like glaucoma drainage implantation, as well as the new technique that we have brought in, what is called as the micro-pulse laser, which is again a portable machine. It's a newly introduced laser which can work wonders in patients hitherto found untreatable. So we are very happy to introduce these techniques to this part of the Karnataka so that the patients of glaucoma as well as the pediatric population can get the justice. Thank you so much.
Collaboration is not new. In fact, we have been in collaboration with the Kodkany Eye Institute since 25 years. Ever since she started her practice, we have been seeing her cases, exchanging thoughts. We have been sending patients to her for follow-up, which we have operated, and she has taken very good care of those patients. So that way we have had a very good rapport. And this today's merger is just a formality. We have merged long ago. The retina services I will talk about because I'm a retina specialist. Formally we started it in maybe 3 years ago during the COVID times when work was low and we could send our junior consultants to Shilpa Kodkany Eye Centre to render retina services in her hospital. And this has evolved over time. This collaboration has evolved over time, and today we have this merger. Just a few things about retina, I'll not take long. Retina is the innermost layer of the eye and the most sensitive layer of the eye. And what the cornea and the lens focuses of the image of the object that we see is imaged on this layer, and it is then taken to the brain and processed there. So the retina itself has got a lot of blood vessels, and it is a sort of area in the body which where only there the blood vessels of the eye can be seen, and that represents the blood vessels of the entire body. So whatever is happening in the body, by looking at the retina, we can make out what is happening in the rest of the body. So that is the beauty of the ophthalmologist's ophthalmoscope by which he is able to see the retina. Retina itself is as I said, affected by several diseases: diabetes, blood pressure, hypercholesterolemia, all these diseases which affect the systemic part of the patient can affect the retina, and these are usually treated. Diabetes, for example, is becoming so rampant in the country that every third patient is a diabetic retinopathy patient, let alone a diabetic patient. Every third patient in our referral center is a diabetic retinopathy patient. That means he's already got affection of the retina and affection of sight by diabetes. And the treatment for this can vary depending on where exactly the affection has taken place. If it has affected the macula, which is the central most sensitive area of the retina, then it causes loss of vision, loss of reading vision, and this can be treated, the swelling that occurs there can be treated by injections. But if there is bleeding because of affection of the blood vessels directly, then that can be treated by either injections or laser photocoagulation, for example. And if it is a severe bleeding, it can lead to severe loss of vision, sometimes detachment of the retina, and this can be addressed only by surgery. And this facility is, all these facilities, injections, laser and surgery, by the world-class equipment and expert doctors. It is available in this Joshi Kodkany Eye Centre today. So that is a change that has happened in the last 3-4 years, and now it has evolved into the state-of-the-art technology, and we have a very good surgeon in Dr. Raghavendra Marigudi, who has joined recently about 3 months ago, and he has started working and rendering service to this part of the country. Thank you.
Thank you. Please give these directors of Joshi Eye Institute a big round of applause for making this technology not only available to us, but explaining it so easily that even the lay people in the audience could comprehend what it was about. Thank you so much, sirs. So as I understand, we have the Z8 versatile portable laser available now, the micropulse laser, the retinal laser, photocoagulation, as well as LASIK and other surgeries which will be easily available to the population of Belgaum. It is said that collaboration has no hierarchy. If we want flowers to bloom, the mighty sun must collaborate with the soil. Well, now that we know what the past and the present was, let us see what the future holds for us. It is a well-known adage that a brand is a promise and a good brand is a promise kept. For public recall and visual impact, every brand needs a logo. Our team at MADE has really worked very hard to make a unique logo for this collaboration. I request the dignitaries as well as all the chief guests to now unveil the logo of this collaboration. May I now also request Dr. Apurva and Dr. Deepti, who are directors of the Joshi Eye Institute, Mr. Raj Belagavi and Mr. Kirti Nerlikar, who are directors of the Kodkany Eye Centre, as well as the three consultants, Dr. Anand, Dr. Sanjay, and Dr. Raghavendra, to join the dignitaries on the stage for the unveiling of the logo. I request Honorable Shri Prabhakar Koreji to make the logo visible by tying the red ribbon around it. Congratulations, Joshi, Kodkany Eye Centre, which is now tied together by this merger. Kudos to the MADE team, our event managers, for this innovative idea of unveiling this logo. I request all the dignitaries to pose with this newly unveiled logo of the collaboration. Though they may be standing on different sides of the logo, they are united for vision. Let's celebrate this occasion with another big round of applause to commemorate. Thank you all. In a world increasingly falling apart and people growing distant, these two institutes have decided to connect and to collaborate. Coming together is a beginning, keeping together is progress, and working together is success. I request Dr. Srinivas Joshi to express his thoughts on this merger.
Good evening, ladies and gentlemen. Respected Shri Prabhakar Kore sir, Shri Raju Sait sir, my teachers at Jain Medical College, ladies and gentlemen. All the invitees, Shri Madhav Gogte ji, Shri Anish, Metrani ji, and the directors of both the institutes. I think most of it has already been said. I don't want to go more in details about these things, but as Dr. Guru Prasad sir said in his speech, that it all started during the COVID time, where we first started the Vitreoretina services. And initially, Dr. Guru Prasad sir used to go for a few weeks, and then I went for a few weeks, and then retina consultants started going there. And that is where we understood that the culture, the values of both the organizations are matching very much like each other. So that's when Shilpa madam and we were having a casual talk and said, Srinivas, why shouldn't we collaborate? And that is where the seed was sown, and now it started showing some fruits, I guess. But why this merger is, I think, is very important. I think one, they have already explained about the technology. We all know that the advancing disease detection is very, very important, and fortunately, I think Kodkany Eye Care Centre along with Joshi Eye Institute has now taken an OCT and OCT angiography. That's the dye-less angiography where we do not have to inject the dye and try to look into the neovascularization of the new vessels. Either it could be a diabetic or it could be age-related macular degeneration. Enhanced technology for detection at earlier and asymptomatic stage is very, very important. Improving treatment outcomes, better treatment outcomes. Madam was behind me, Srinivas, we want the best, we want constellation here, we want the constellation here. And fortunately, we had a 1 crore rupee just for vitreoretinal surgery, the constellation which is being installed here, along with the Z8 technology which Dr. Satyamurthy sir has already told about it. So why Z8? We worked into looking at how much it costs. Once you go to Mumbai or Bangalore, it costs 1.45 lakh rupees. We worked at the pricing at Joshi Eye Institute, and we thought that we should price it at 75,000 rupees, just half the rate of what is being charged at Bombay and Bangalore. So what's the aim? The aim, I have said it earlier, to give the best of the technology at an affordable price is the aim. That is why we have named it as United for Vision. The most important thing I would like to tell my dear friends, Joshi Eye Institute last year itself has seen 93.5 lakh patients, sir. So how did we do that? With the 13 tertiary care hospitals, 22 vision centers, the door-to-door survey, Dr. Joshi always used to strive, Kereya neerannu kerege challu. Do something giving back to the society. Is where our door-to-door, we have more than 122 staff healthcare workers working in these villages. They go door to door, identify these patients, bring them to the vision centers, treat them where it is possible, and if needs a surgery, then refer back to the base hospital. Why do we do this? This is a community angle. Why do we do this? As I said earlier, again, 1,000 surgeries are being done free of cost every month. How many do we screen? 87.5 lakh screenings are happening every year. So with the merger of Kodkany Eye Care Centre and Joshi Eye Institute, it's not just to bring in the best of the technology, but also cater to all the economic sections of the society. That is very, very important. And those who are poor, they need not go back without saying that I don't have money and I'm not going to get a good vision. And this, we are trying to give a birth to multiple vision centers, which is not for profit making, and try to see if we can make an entire Belgaum an avoidable blind-free district. And that is the aim why Joshi Eye Institute and Kodkany Eye Care Centre have come out together. Just last point I want to make, because everybody asks why this merger, why this merger? Merger means only, is it the financial things in the merger? Yes, everybody has this doubt, but I would like to clear it here is hospital mergers allow organizations to combine resources, leading to improved access to advanced technologies, specialized staff and expanded medical services. My dear ladies and gentlemen, I would like to clear it right here away. It's not for the financial purposes why we have merged together, but to give the increased eye care services to the areas of the Belgaum, to the people nearby Belgaum areas, including the people who used to come all the way from Goa to Hubli, and now we can have a greatest of facility in Belgaum itself. The merger helps reducing the operational cost by eliminating the redundancies, gaining economies of scale in purchasing, administration, and streaming eye care pathways. So my dear friends, seniors, ladies and gentlemen, here we are here together, and as Madam rightly said, I think the slogan has already been revealed. It is only one point. It is United for Vision, and we need your blessings. We need your support for a long way, because we have just started our journey. We have just started both the journey with the baby steps. With your efforts, with your blessings, with your support, I'm sure this is going to go a long way further. Thank you very much once again.
Thank you, Dr. Joshi, for your yeoman service to provide affordable technology for the people of Belgaum. I now call upon Dr. Shilpa Kodkany to share her thoughts about the future on this occasion.
Well, Srinivas has said it all. Just to put it in a nutshell, 25 years of KEC have gone by, and the next at least 25 years are going to be extremely exciting, bringing in cutting-edge technologies. And like Srinivas said, these technologies are for all the communities of people in and around Belgaum. Thank you so much.
Thank you, Dr. Shilpa. So they have a combined experience of more than 85 years together, because Kodkany Eye Centre is 25 years old and Joshi Eye Institute was established in 1967. To paraphrase the famous Sufi poet Khalil Gibran, the river is fearful of entering the vast ocean as she looks back at her journey, the path that she has traveled. But she needs to take this risk and go forward, because merger is not about disappearing into the ocean, but of becoming the ocean herself. We all wish you the very best in this endeavor, and I'm sure all our guests would also like to shower their good wishes upon this occasion. May I now call Shri Madhav Gogte to share his thoughts on this occasion, please.
Honorable Joshi ji, Shri Prabhakar Kore ji, Shri Raju Sait ji, Shri Anish Metrani ji, dignitaries on the dais, family and friends. First of all, a lot of people must be wondering, what is he doing here? Neither I am a doctor nor, but for Shilpa, as Shilpa said, I am a family member. So for Shilpa, I had to be here. The Gogtes and the Kodkanys, we go a long way back. Our families are known to each other for generations. My parents knew Dr. Kamal Kodkany and Dr. Kodkany, whom we fondly used to call Papa. Their name and their legacy is carried forward today in the same manner by Dr. Shilpa. The insurmountable faith the Belgaonkars had in them is so obvious that almost 50% of the babies were delivered during their practice time. Dr. Kodkany's eye clinic is an iconic center, and the same amount of faith and trust people of Belagavi have shown in Dr. Shilpa's surgical skills. Dr. Shilpa, she also is a very shrewd businesswoman. She exactly knows the climatic conditions, when it will rain, when there will be sunshine, when to join hands, when not to. But Shilpa, I think you have done the right thing by joining hands with the prestigious Joshi organization. What can I say about Shilpa? जब इंसान को कामयाबी मिल जाती है तो इंसान की इज्जत बढ़ जाती है, लेकिन कुछ लोग ऐसे होते हैं कि जिनको कामयाबी मिल जाती है तो कामयाबी की इज्जत बढ़ जाती है. That's Shilpa for us. I wish Dr. Shilpa and Dr. Joshi ji all the best in this venture, and I'm sure this will be a milestone for the city of Belgaum. Thank you.
Thank you, Mr. Gogte, for highlighting this Kodkany family legacy, which is being carried on ably by Dr. Shilpa. I have a small announcement to make. May I request the owner of car number KA22ME0507, KA22ME0507, to kindly move your vehicle which is obstructing the traffic. There is ample parking in the premises. If you could bring your vehicle inside, that will be very helpful to us. We would now all like to hear from our Honorable MLA, Shri Raju Shetji. May I kindly request him to say a few words on this occasion.
Good evening. On the dais, Dr. M. Joshi ji, who is an institution by himself in the field of eye care. More than knowing or meeting him, I used to read about him. More than the expertise, I used to read about his cataract surgeries in villages, in towns, that he was doing free of cost, doing philanthropic activities, helping people. Mrs. Joshi ji, Dr. Prabhakar Kore Sahab, whom we have known for a very long time, I would say he is the, if I may call it, father of education, father of medical care for Belgaum city, because he has brought education and medical care to a different level in our town, and I thank him for that. Dr. Samir Joshi ji, Dr. Shilpa Kodkany and Kirti, we have been very old friends. More than working, they used to have their candlelight lunches together, which I used to always ask them. Directors of the M. Joshi and Kodkany Eye Centre, ladies and gentlemen. For better services, let it be any field, you have to collaborate, you have to merge with institutions. Once you merge with other institutions, then you can give better care, better facilities. And I hope and wish and I know that M. Joshi Eye Care Centre and Dr. Shilpa Kodkany Eye Centre will, after their merger, will give immense and good eye care to the city of Belgaum, and an affordable one also. And I thank them for inviting me here and wishing them all the best in the future. Thank you very much. Jai Hind.
Thank you, sir, for your kind words and blessings on this occasion. It is now time for a very heartfelt ceremony where Dr. Shilpa would like to felicitate one of the people who she really admires and respects. May I request Dr. Shilpa to kindly escort Shri Vittal Yargi to the dais. There is nobody in this audience who does not know about who is Shri Vittal Yargi, fondly known as Vittu Kaka to everybody. He happens to be the oldest patient of Kodkany Eye Centre. He's a freedom fighter, a dramatist, and I am told he used to be a very, very noted electrical engineer back in the days. Shilpa would like to felicitate him on this occasion. He is 99 years young. Please give it up for Shri Vittal Yargi. May I request Mr. Kirti Nerlekar to also join Shilpa in felicitating Mr. Vittal Yargi.
has arrived, we are truly blessed to witness the felicitation of the stalwart of ophthalmology, a guiding force for this merger, a father figure to many ophthalmologists, and a divine light to myriad of his patients, Padma Shri Honorable Dr. M.M. Joshi. I request Dr. Shilpa and all the dignitaries on the dais to do the honor. I call upon Mrs. Pramila Joshi for the felicitation. Padma Shri Dr. M.M. Joshi was born in the village of Nimbar in Vijapur district. He was the first postgraduate ophthalmologist to start a private practice in Karnataka. Dr. Joshi established M.M. Joshi Institute in the year 1967, which has grown into a Superspeciality hospital and a postgraduate institute over the years. The first eye bank was established by him, and he is also founder of the Karnataka Ophthalmologic Society in the year 1980. Sir has strived hard to cater to needs of the community, and for his commendable contributions, he has received several accolades. Rajyotsava Prashasti Award by Government of Karnataka in the year 1989, Lifetime Achievement Award of All India Ophthalmic Society in the year 2015. He is a recipient of an honorary doctorate from Karnataka University, and he is also the recipient of Padma Shri in the year 2016 for his outstanding contributions to the community. I call upon Shilpa to felicitate sir. I request Honorable Chancellor Dr. Prabhakar Kore to do the honors. May I request Dr. Joshi to share his insights and enlighten us?
सर्वे सन्तु सुखिनः सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्. With this prayer to the Lord Almighty on the occasion of the union of two institutes, M. Joshi Eye Institute and Kodkany Eye Institute, I am very happy that a person, Mr. Vikram Yalgi, has been felicitated as the first president at the age of 99. I am here. I am very happy that I have been able to find one more person who is elder than me in this. I am 91 and he is 99. I am very happy, sir. Complete 100 years. On this occasion, the chief guest of the function, Dr. Prabhakar Kore, Dr. Gogte, Mr. Gogte, Sir Raju, Sait, Metrani, and Sait, Raju Sait, and Dr. Rajshekar, Dr. Jali, Dr. V.D. Patil, and Dr. Shivram, the President of Karnataka Ophthalmic Society of today, and the esteemed invitees and ladies and gentlemen sitting in the front of the dais. Kindly excuse me for sitting and talking to you, and my delivery is not very smooth. However, I am very happy that a person of His Eminence like Prabhakar Kore has been the chief guest of this function, because he is a builder of the institutions. Here we have joined two institutions and made one, while he has made hundreds of institutions, and then he has revolutionized education in the North Karnataka area. I know the Saptarshis, I know and one of the Saptarshis, his grandson was my classmate in Hubli. I am very happy that many of the people who have come here for this union of the two institutions. Actually, in very short, she introduced my career starting in 1967 when I was in KM Hospital, Bombay for my post-graduation. Fortunately, I had made a good name in the department, and Dr. Prabhakar Dr. Prabhakar Belland, who was the senior registrar in anesthesiology himself, and Dr. Jirge's daughter Lata Jirge and Dr. Jivan Jirge were the students of KM Hospital. They were my colleagues. Very fortunately, we were good friends because we were Kerala speaking people. And whenever Jirge used to come, they used to talk to him about me. And Dr. Jirge was very nice to tell me that you should come and join our institution after you complete your tenure here in KM Hospital. I said I will try, and as it happens, you are taken to the place where you are destined to start your practice and live there. I went to Hubli, and then there one of my senior, Dr. Subha Joshi was there. He said, why don't you go and then ask in the government college, Karnataka Medical College. Dr. Amrit Raj was the dean of the medical college. When I went and saw him, he said, Doctor, you have got all the qualifications to become the medical officer here, honorary medical officer, but you are late by 1 month. And however, I will include you and then send it to the health minister, who was Nagapalva, who was there at that time. I am very happy that I started the practice in 1967, and I am not I'm not very proud to say that, but I was the first postgraduate degree holder in ophthalmology to start practice in Karnataka, including in Bangalore and Mysore. And very fortunately, I was very well trained in Bombay. At that time, that was supposed to be the second institution south of Suez, KM Hospital. I was well trained, and a very short time, I made a good name in Karnataka and Hubli, and later on in Karnataka for that matter. And I started having good practice. After starting the practice, I was having enough work on hand. However, I was tempted to do the free work, that is community service, as I already told in my inaugural function at the Kodkany Eye Institute. You see, we are trained from our childhood in good sanskara. Matrudevo bhava, Pitradevo bhava, Acharya devo, Atitha devo bhava. And on top of this, I would like to say Samaja devo bhava is one of the things, for one simple reason. Because we become doctors, not because we have secured high percentage of marks in intermediate science or PUCs too. We become doctors because the public has contributed immensely towards the tax payment to the government, and the government runs the institutions. Nowadays, of course, Dr. Prabhakar has started the private institutions, and then later on there has been facility for other people to join it. But otherwise, when we joined, there was no possibility of entering the medical colleges except Manipal, which were charging 3,000 rupees as the admission fees. And 3,000 was very big at that time. However, Dr. Kore has done immensely well in starting many institutions, and I'm very happy that he has started one institution in Hubli also, wherein my grandson is being educated there. I am, and the whole of North Karnataka should be very much proud of him for having started the educational institutions all over to the tune of 200, 104. And now, as I told you, in spite of having my good practice, I started doing free work, which made me popular, not only popular, but also dearer to the God. Made me dear to God because, in Shastra it is said, Nana janasa sushrusha kartavya kartabinvite. As we pay taxes to the government when we earn, we pay taxes to the God by serving the poor people in the society. And as Srinivas Joshi has already told it, nobody would go back because he cannot pay the fees for our services. I'm very happy that I have been able to build the institution, and now the second generation, including my daughter-in-law Dipti and Apurva, they have been contributing a lot, and now we have been spreading the institutional help to all the places wherein the services are not very available, are not available. We have started in Raichur, we have started in Bagalkot, we have started in many other places, something till 12 or 13 places. And all this happens because not you are having the caliber, because you are the person who have been chosen by the God to do the work. We are the instruments in the hands of the God. Myself, whether it is myself or whether it is Prabhakar, Kore for that matter. Yes, we are the instruments in the hands of the God to do the particular work. He has chosen us to do this particular work, and that's why we have been doing this. I'm very happy that today 2 institutions have joined and they have been made united to serve the community of Belagavi and around people, for which I'm very happy, and I thank you very much for my listening. Thank you very much.
It was indeed a privilege listening to you, sir, and thank you for sharing your words of wisdom. Dr. Srinivas Joshi would now like to appreciate the efforts of a few important people. I call Dr. Joshi.
Thank you. Before we go on to the last part, that is keen and eager to listen to Kore Saab's address. Before that, I would like to thank the people who have made this association possible. I request Shri Honorable Kore Sir to please honor people. I would like to call upon Mr. Sheshgiri Kulkarni, chartered accountant, well-known chartered accountant from Hubli, to please receive a bouquet. I call upon Mr. Chirag Kataria, and Mr. Raj Belgamkar, the ever smiling. Yes. Like to also take the names of our staff from Joshi Eye Institute, Mr. Qutbuddin Mullah, Mr. Mahesh Dongre, Mr. Ketan Nagda, and many of them. You can please come in quickly and Vande Kod. And entire staff of Joshi Eye Institute and Kodkany Eye Care Centre. We thank them. We are just the face of this organization, but these are the real true heroes or heroines, I would like to say. They are the people who make us work more and more harder. Last mention is, not to forget, is the presence of our President-elect, who is going to the President of Karnataka Ophthalmic Society, Dr. K.V. Shivram sir, who is also here with us. And fortunately, he is also a part of Joshi Eye Institute. Joshi Eye Institute has spread its wing in Sirsi, Sagar and Bhatkal in the coastal areas as well. So I request Shri Prabhakar Kore sir to please honor Dr. K.V. Shivram, President-elect, Karnataka Ophthalmic Society.
I deem it a pleasure and privilege to introduce the esteemed chief guest of today's function, Honorable Dr. Prabhakar Kore, Chairman KLE Society, Chancellor KLE Academy of Higher Education and Research Belagavi and KLE Technological University Hubli. Sir is a multifaceted personality with significant contributions in the field of education, agriculture, healthcare, politics, and community welfare. Sir took over the reins of KLE in the year 1984, and under his dynamic leadership, KLE institutions have expanded from 38 to 330. Sir has also been instrumental in establishing various national and international collaborations with World Health Organization, NIH, thus facilitating and promoting research and placing KLE on the global map. His accomplishments and accolades include, to name a few, because he has severe accolades to his credit, Outstanding Educationist in the year 2004 by Giants International Group, and this award was conferred by Shri Amitabh Bachchan. Lifetime Achievement Award by TIE, the Indus Entrepreneurs in 2013, conferred by Shri Ratan Tata. Honorary Doctorate by University of Malaysia in the year 2015, and Sir is the second Indian after Bharat Ratna Honorable President Dr. APJ Abdul Kalam to receive this honor. Honorable Dr. Kore is the first Indian to receive the honorary degree of Doctor of Science by Thomas Jefferson University, Philadelphia, US in May 2022. Sir has always given community service a priority, and with his zeal and enthusiasm, he has done commendable contributions to the community. With this, I kindly request Honorable Dr. Prabhakar Kore sir to address the gathering.
ಎಲ್ಲರಿಗೆ ನಮಸ್ಕಾರಗಳು. ಇವತ್ತಿನ ಐತಿಹಾಸಿಕ ಯುನೈಟೆಡ್ ವಿಜನ್ ಜೋಶಿ ಮತ್ತು ಡಾಕ್ಟರ್ ಕೋಡ್ಕಿನಿ ಅವರದ ಇದೇನು ವಿಜನ್ ಜಾಯಿಂಟ್ ಆಗಿದೆ ಬೆಳಗಾಂ ಜನರಿಗೆ, ದಿಸ್ ಇಸ್ ಹಿಸ್ಟಾರಿಕಲ್, ಐ ಕ್ಯಾನ್ ಸೇ ಹಿಸ್ಟಾರಿಕಲ್ ಯುನೈಟೆಡ್ ವಿಜನ್. ಸಿ Joshi in Karnataka, everybody know about Joshi. And I since very long time, even before I have become a chairman, I met him in Hubli. I was quite young, just I wanted to show my eye, whether eye is correct or not. That was, I am not a patient, but just to check because I heard. Today is a name in every Karnataka city, Karnataka citizen. This is more important at prestige. Of course, Dr. Kodkany, Shilpa's father, Shilpa's mother, they are both gynecologists. I think in Belagavi, somebody has said more than 50% the delivery is done by the Kodkany, both husband and wife. That is a privilege of this. She was mentioning she don't want to become a doctor, in fact. And almost 1 week, every day Kodkany bring to my house, and I convinced you must go because your parents are doctors, you have name here, you must become a doctor. Somehow she joins her. But after MBBS, I wanted she must become a gynecologist. She know that gynecology is a very tough job. Ophthalmology very easy. There is no patient, serious patient, nor you find a death patient also. So somehow she joined ophthalmology, and today she's made a name in Belagavi. I'm very proud of her, In fact, one more important is both Kodkany and Mr. Joshi. Srinivas again is a KAHER student, and Shilpa is both are Sangama together after even completion of their graduation from JNMC. And Mr. Joshi was telling me his granddaughter joined Hubli Medical College. So this is maybe third generation they're joining in JN Medical College and KLE. I'm really very happy. Only one complaint I have, Shilpa. See, after that, after becoming a doctor, somehow I match with Kirti Nirlekar. That was also done by myself. But still that royalty has not paid me. So at least I must get my royalty from Kodkany's property, not from Shilpa's property. And really I am very happy. This is really something new. Belagavi required, and many patients used to go to Joshi's hospital in Hubli. And whenever I see in Hubli, I pass in front of his hospital, I feel proud, such a ophthalmology, big hospital, you will find such in Belagavi, small place in Hubli. And today I think the whole medical, even hospital system is going to change. I think this is the 12th center they are opened in Belagavi. Like that, Vasu he has opened throughout the world. I think he's a Madras fellow. Vasu, na? Vasan. Then Paranjaipe group has started this thing. Then recently dental people have started in many cities. In future, after artificial intelligence, I don't know whether this hospital will be really lot of change you will find after AI, even in every field, even in surgery, even in medicine, everything you will find a change. You have to be prepared for this. And I'm really very happy. And I still remember Dr. Kodkany, where is my good friend. All the time he was advisor to me. And thank you, Shilpa, you called me and remember me. Thank you. Thank you very much.
Thank you, Honorable Dr. Koreji, for convincing Shilpa to become a doctor. We got a great ophthalmologist in Belgaum because of you. We could experience from your words your pride about the legacy of Dr. M.M. Joshi and Dr. Kodkany. Thank you very much, sir, for your kind words. Well, as we draw towards the end of this function today, we will be failing in our duty if we did not express our gratitude to the so many people who have helped make this event a success. An event of this magnitude cannot be pulled off without the hard work of many, many agencies and also the presence of esteemed guests and erudite audience like you all. I request Dr. Guru Prasad, Director of M.M. Joshi Eye Institute, to propose the vote of thanks.
Good evening, everyone, once again. So it's indeed a moment of great pride and optimism as we stand here today in a landmark occasion, a very important occasion, an iconic occasion, the official merger of M.M. Joshi Eye Institute, an iconic name of national repute, and Kodkany Eye Centre at Belgaum, two esteemed institutions coming together to build a stronger, more unified future in healthcare. 1 + 1 is actually 2, but we want to prove to the world that it is 11. On behalf of both institutions, I extend my heartfelt gratitude to each one of you for gracing this important event by your august presence. First and foremost, I wish to thank our chief guest, the iconic name in the field of education, Shri Prabhakar Kore, Chairman of KLE Society and Chancellor, KLE Academy of Higher Education and Research, Belagavi, for taking time out of his demanding schedule to be with us today and spent almost 2 hours. Your inspiring words and encouragement mean a lot to us and reaffirm our commitment to excellence in healthcare delivery. I sincerely thank Shri Raju Sait, MLA, Belgaum North Constituency, who has been kind enough to make it convenient to attend this merger event, leaving aside his personal and other pressing commitments. I sincerely thank you for your support and your kind words. Our special guests today, Shri Madhav Gogte ji, Managing Director, Gogte Group, and Shri Anish Metrani, Managing Director, Sneham Taping Solutions Private Limited, have had a special role today in infusing inspiration in all young and established entrepreneurs alike. Thanks for a graceful and meaningful presence today, sir. The Bhishma Pita of all ophthalmologists in the state, mentor to scores of young minds, professional guide to hundreds of doctors, ophthalmologists, and otherwise, Padma Shri Dr. M.M. Joshi is just 90 years young, has sat through the entire proceedings even at the age of 91. We are thankful to both Srimati Premila Joshi and Dr. M.M. Joshi for braving all odds and being with us today. I would like to express our sincere appreciation to the board members, trustees, auditors, directors, and leadership teams of both hospitals, whose vision, collaboration, and tireless efforts have made this merger a reality. Your foresight and determination are truly commendable. Thank you very much. A special thanks to all our doctors. I will not take the names of each one of them. Paramedical staff, nurses, administrative teams, and supports personnel who are the backbone of our daily operations. Your adaptability, professionalism, and continued dedication during this transition period are both reassuring and inspiring. To our patients and their families, I'm sure there are some who have come here. Thank you for your trust over the years. This merger is ultimately about serving you better with enhanced facilities, expanded expertise, and a broader spectrum of care. And as already said, we are united for vision for you. I would also like to thank the media, our partners, vendors, and all stakeholders who have supported us in this journey. Your partnership and goodwill are invaluable as we step into this new chapter. And finally, to the organizing team of this function, Ms. Apurva and team, thank you for putting together a seamless and meaningful event to mark this milestone. I will fail in my duty if I don't thank Dr. Aswari Sant and Dr. Vaishali Keluskar, who did an excellent job in being the master of ceremony for this excellent event this evening. And thank you very much for the way you conducted this program. As we move forward united, let us remember that this merger is not just about joining forces. It is about combining our strengths to create a healthier future for the communities we serve. Thank you all once again, and let us look ahead with hope, purpose, and shared commitment. Thank you, and Jai Hind.
We request Madhav Gogte ji to please give a floral bouquet to Dr. Aswari Sant. And Mr. Anish Metrani ji to Dr. Vaishali Keluskar. Thank you all for having a patient hearing to all the proceedings that we did. It was very necessary to do this, and after having waited for so long, now the bar as well as dinner is open for everybody. Thank you all so much for a patient hearing. Thank you. I request everyone to rise for the national anthem.
जनगणमन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे